Thank
There
you.
you go, thank you. Good afternoon.
Hello.
May I sit down here?
Please do.
Okay. My name is Bob Squirn. I'm an Associate Clinical Educator with Meducate Academy. Today I've been asked to perform a blood pressure examination on you.
Yeah.
I just need to confirm your name and date of birth.
Mark Reynolds, 26th of August 1966.
If you don't mind me asking, how old does that make you?
59.
59. Okay. I need to ask you, have you ever had a blood pressure reading taken before?
Several over the last year.
Yeah, I believe you have got some issues with blood pressure anyway, and you take
Yeah.
medication.
That's right.
Lodipine, is that
Amlodipine,
right?
yes.
How are you getting on with that?
Okay, I think, but it just
Okay.
depends how these readings go going forward.
Yeah, of course, and that's what we're going to do today. Now, I just need to ask you a few questions. Do you feel relaxed? You haven't come running in, you haven't had a cup of coffee or a beer, you haven't had a smoke or anything like that. Okay. You're probably aware that these things can raise your blood pressure. I want you to be as comfortable as possible. Obviously, in order to do this, I need you to face that sort of direction so I have access to your left arm. Is that okay? And your preferred arm is the left arm?
I think so, yeah.
Okay. If I can just move a little bit closer, okay? Okay, just quickly wash my hands again. Just touch the chair. Right, okay. So the first thing I'm going to do is assess your radial pulse, okay? I can time this if I wanted to, but for the purpose of this, all I need to do really is get a good measurement of it. Is it rhythmical? It is. It's good, it's regular, good regular rate, rhythm and character is good. Okay, it's not weak, it's not thready, it's not bounding. Okay, right, so pulse is fine. What I need to do now, obviously, is put the blood pressure cuff on. Like you say, you've had one of these on before.
I have.
So you're aware that's going to get tight.
Yeah.
Okay. Right, let's just pop that on there if you don't mind. Thank you.
Okay.
Just, for the purposes, you can just roll this up for me, please, Mark. Can I call you Mark?
Please do.
That's okay.
That's fine.
Yeah. Okay. Let's just put this up. Okay, I'll make sure that the arrows and the pipes are right over the brachial artery, okay, which is located on the medial aspect of the bicep tendon. And I can feel that there. It's good, steady pulse. Okay, what I'm going to do now is find your systolic pulse. That's going to involve me closing the valve on the blood pressure cuff, putting this figure in front of me, palpating for the radial pulse, which I've got, and I'm now going to pump this up until the radial pulse stops. Okay, this may be a bit uncomfortable. Please tell me if it's too tight and I'll stop. And I've lost the radial pulse there, great, which means it's been occluded, and it was 140, 42. So what I'm going to do now is I'm going to just release that pressure there. Okay. You okay still?
Yes, thank you.
Okay, that's excellent. And what I'm going to do now is using the stethoscope, I'm going to listen up the brachial pulse. You probably remember getting this done years ago, yes? Well, how long ago was it when you
I was
had?
diagnosed just over a year ago.
A year
with
ago.
high blood pressure.
So I'm assuming they did the same thing.
Indeed, over and over.
Okay, yeah.
Yeah.
So, just checking, I've got the diaphragm. If you could just pop your hand on there for me, that's great, that helps me out a great deal. I'm now going to pump this up again, but this time 30 millimetres above the original reading, which was 140, was it? I think I said that. Okay, so that's the systolic, and now, okay, so about 170 there at the moment. Okay, so I'm going to now release it very slowly, so you should feel the cuff loosening. And I'm listening for the first sounds. So that's when the pulse starts again, the heart starts beating and pushing the blood down towards your hand. And it's 144 and 45, 145 when the first sound started. And the pulse is now stopped, so the fifth sounds were at 90, 89, 90. Okay, I'd like to repeat that another 2 times, so I get an average. I think for the moment, I think I'm okay with that. So the reading is a little high, a little on the high side again. So let me just take this off, let's pop that on there, sorry about this. Bit of a cut there. Let's take the cup off. So yeah, the blood pressure readings are still a wee bit high. Have you been taking your medication yet?
Yes, it's amlodipine,
Yeah.
5 milligrams.
Yeah.
I take it once a day.
You take it once a day, and
Yeah.
you've not missed it at all.
No.
What's your diet like? If you don't mind me asking.
Well, it kind of had to improve really,
Ah,
because
okay.
that came out of my initial consultations that my diet was poor. So I cut down on lots of things, including my salt intake.
so you have cut back on your salt intake.
Yeah, yeah.
Do you do any regular exercise or anything like
Not
that?
really.
Okay.
My work doesn't allow me to do that, and to be honest with you,
Mhm.
I've been quite stressed lately.
Ah,
so
okay.
whether stress levels affect blood
Yeah.
pressure.
Well, yes, I mean, yeah, of course they affect blood
yeah,
pressure.
yeah.
I mean, some people are even affected, you know, we call it the white coat phenomenon, just coming for a blood pressure can often
I'm used to
elevate blood
that.
pressure. Yeah, I gathered that.
But
You seem pretty
out
relaxed.
there, I'm stressed.
Yeah, okay.
Professionally, you know.
So I think we need to look at a couple of things here. You know, you've probably been told many times about this, and I don't want to bang on about it, but diet's really important, so is a little bit of exercise. You know, watching your salt intake's important.
I think a little bit of exercise is where I'm missing out. I was going to say actually,
Yeah.
you know, obviously, is there an option to increase the dose of my amlodipine?
Well, there is, but I think before we jump to that, let's not jump to that straight away. I'm not too concerned at the moment, but it is high.
So is there anything else I can do then?
There is, yeah.
Yeah.
And that's what I was going to come to. We can get you. Have you got a blood pressure machine at home?
Yes.
The electronic ones,
Yes.
yeah.
Yes.
Yeah. What a bit of advice, if you don't
Yeah,
mind me saying,
that's all right.
in the mornings when you get up, first thing before you eat anything like that,
Yeah.
take a reading,
Okay.
write it down, a little
Yeah.
journal,
Yeah.
and then do it last thing at night,
Okay.
right? And then we'll have a look at those readings next week. In a
Mhm.
week's time, we'll come back and we'll reassess. And it
Okay.
may be that was a bit stressful here. Maybe you've, you know, had a bit of a bad day today, and it was artificial. We don't want to, you know, just sort of knee-jerk reaction and up your meds. We
Okay.
want to actually, you know, have a look at generally over a period of time.
Okay.
So if you would do that for me,
Yeah.
that would be great. And
Okay.
we'll see you in a week's time,
Okay.
7 days time.
Yeah, I can do that.
Mornings, evenings. So if you just feedback to me, what did I say? So I just want to make sure you
Yeah,
got it
because I've
right.
had that blood pressure machine. I haven't really used it to be honest.
Okay, so you know how to use it.
Yeah, yeah, it's easy. You just plug and goes with it. Not like
Right.
that. It's not
No,
like
no,
the
that
ones.
takes a little bit more skill.
Yeah.
Yeah.
So yeah, so I'll use
So you're
it
gonna do that?
morning, evening.
Yeah.
Keep a journal of the readings.
Yeah.
And let you know what they are next time.
And anything about your diet? Try to cut back on.
Well, it's not really diet. I think it's exercise. I think it's dealing.
Okay,
With, I think
okay.
it's dealing with stress at work.
Right. Is there any way you can alleviate that?
Not really. Not when you're the sort of head honcho. It's hard.
Okay. I
It
get
all
that.
comes back on me, which is why I'm stressed.
Yeah. Yeah. Yeah.
Yeah, there's no way for the buck stops with me, you see, and sometimes it does get you. I mean, that's why my wife sent me to the Well Man Clinic over a year ago. She was worried about
And that's
the
where
effect
you
work
found
has
End
had
of
on me.
station.